We also have three speakers. We have Rabbi Berman, Dr. Mormon, and Dr. Arthur. Rabbi Berman, will you please begin? Thank you.
Thank you all very much. I hope you won't mind having to attend your synagogues are different from buses, right? Synagogues fill up from the back, and sometimes it's always difficult to get people to sit in the front. So those of you who are in the back, if you wouldn't mind coming and sitting in the front, that would make things a little bit easier. For those of you who don't understand why I'm not using the microphone, it's because in Jewish law on the Sabbath, there is a ritual in action which is of supreme importance. Much as most people are familiar with the ritual in action of not eating, of fasting on a particular day, in order to manifest the subservience of the body to spiritual purposes, on the Jewish Sabbath, there is the ritual in action of not utilizing, not engaging in the productive transformation of goods and stuff that exists in nature or that is being manufactured by human beings in order to manifest our awareness that God is the ultimate source of productivity in this world, and not human beings. And therefore, by refraining from engaging in such productive activities, we believe that we're making a significant symbolic ritual statement. And so I will not be using the microphone. I hope you'll be able to hear me. At this point, can people in the back hear me? Yes. Okay, very good. The question I was going to address in this session is, with some slight modification, in what sense can illness be a spiritual or religious experience? So first let me start with a definition of spirituality. These are big topics, and we're allocated very little time, and the temptation is to engage in great sort of broad generalization. And I'm reminded of the story of the rabbi on the plane who starts a conversation with the man next to him, and the man turns to him at one point and says, "And what do you do?" And he says, "Well, I'm a rabbi." The man turns away for a moment and then turns back and says, "Gee, I really know almost nothing at all about religion, but I know that all of religion can be summarized in that famous phrase, 'Love thy neighbor as thyself.'" So the rabbi was somewhat dismayed at the degree of generalization in that, and turns to his neighbor and says, and what do you do? And the man says, "Well, I'm an astrophysicist." And the rabbi turns away for a moment and then turns back to him and says, "Gee, well, I really know nothing at all about astrophysics, but I know that entire discipline can be summarized in that famous phrase, 'Twinkle, twinkle, little star.'" So I would like to manage to avoid that degree of generalization. In order to do that, let me just tell you functionally how I understand spirituality, right, in 5 sentences or less, in order to address the issue that we need to address. So my working definition of spirituality is that spirituality is an awareness of the presence of God and or the awareness of an ultimate set of values and virtues by which human beings ought to govern their lives. And that through one or both of those, people form meaning in their lives. All right, that's sufficiently clear? So now what happens when someone is ill or is suffering? It seems to me that for a person who has spiritual awareness, for a person who has spiritual sensitivity, the occasion of illness or the occasion of suffering instantly causes difficult confrontations. First of all, with the role and presence of God in their lives. Is God the cause of this? Is God not the cause of this? How do I understand such an occurrence in my life, in a life in which I have a consciousness of the presence of God? And secondly, it causes a challenge related to one's sense of meaning based on the virtues and values that one considers to be central to their life. And that is, am I leading my life in a way in which the core purposes that I understand to be essential to my life are really being engaged in an appropriate manner? So let's take a look at those in turn. Firstly, in regard to the question of one's experience of God in life. So, what happens when someone is sick or someone is experiencing suffering? Well, so you turn to the question of, so where is God in all of this? The Bible itself, certainly the Jewish Bible itself, presents many different models, many different paradigms of the role of God in relation to human illness or human suffering. Human illness or suffering can be in consequence of sin, can be, as it were, a punishment for sin or crime. On the other hand, it could be an opportunity for expiation of sin, and therefore manifestation not of divine anger, so to speak, but of divine love. Suffering and illness can be in consequence of a lack of faith. On the other hand, it could be a test of faith, as it is in the case of Job. It could, in fact, have nothing to do with the direct will of God at all, as certainly in Maimonidean thought and in some elements of biblical thought, in which there's a recognition that God, as the creator of the universe, has created human beings with free will, and that God does not rescue us from every occasion that someone else's evil desire manifests itself in injury to us. Or for that matter, God, having created the world out of matter which is innately decayed, and which has rules of its own, God reduces God reduces God's own engagement with the constant governance of those elements of nature and the natural order, so that there are in fact moments when a tsunami occurs, and it is not necessarily the will of God that tsunami injures only people who are guilty and only people who are sinful. But it takes, as it were, the innocent with the guilty. As apparently even God himself and Abraham, when Abraham argues with God about the destruction of Sodom, and Abraham stops at 10. Did you ever wonder why Abraham stopped arguing with God at the number 10? He says, if there are 10 people, will you destroy Sodom? God says, no, if there are 10 innocent people, I won't destroy Sodom. Is that about 9? So you're willing to tolerate that 9 innocent people will die, right? For no reason other than all the rest of that population are evildoers, right? But the 9 are sort of collateral damage, and that's okay for you. But 10 people to die in collateral damage, that's not okay for you. But the point is that, in fact, this notion clearly exists that the world being as it is, not everything that occurs in the world, except in the eyes of the mystics, not everything that occurs in the world is the direct consequence of God's action. So what does the person make of that? What is a person who's now suffering illness, suffering some pain and anguish, what is that person to make of the presence of God in their lives? Is this direct cause of God? Is it not the direct cause of God? Does God have a hand in this? Does God not have a hand in this? So in the Jewish tradition, the answer to that question is clear. And that is that there is no answer to that question. That is, short of prophetic revelation, there is no way in which any human being can know whether God intended this to happen to me or did not intend this to happen to me. Nevertheless, what is produced at that moment is a sense of as it were, meeting God, a sense of challenging God, of asking oneself about God and asking God about oneself, in saying, what does this event mean in my life? What do I really understand about God's will for my life? Am I in fact leading my life in an act of cheshbon hanefesh, in an act of personal self-evaluation? Am I leading my life in such a manner that I believe that this is would be an unwarranted punishment for me, an unjustified suffering? That God might not in fact want this to happen to me, but it's happening to me nevertheless. And then there's the second layer of deliberation that then takes place. In that second layer of deliberation, there's the question about, so what does this mean though? About the way in which I am living up to my own ideals in terms of the values and virtues that are central to my life. And is there a reordering that's necessary? I believe that every spiritually sensitive person, as a deist, would ask himself those questions about God. As a spiritually sensitive person who believes that there are really virtues and values that are central to human existence, that generate a sense of meaning in his or her life, has got to ask himself or herself at that moment, so am I really leading my life in the best possible way that is most likely to enable me to achieve these goals in my own life? But aside that theological layer, there's a second layer. And that is, in Jewish thought, there's a normative layer. There's a layer of law. And there are two elements of Jewish law that bear a specific relationship to this question of the spiritual confrontation that takes place in the face of illness and suffering. One is that Jewish law forbids self-injury. Right? The Torah itself, the Bible itself, in the book of Deuteronomy, beginning in chapter 14, legislates the impermissibility of tearing one's body in mourning. Right? That is, even in a moment in which one feels that something has been torn from them, that nevertheless one is not permitted to scratch, to tear the body in manifestation of mourning. Which is, by the way, probably one of the reasons for the traditional Jewish custom of tearing a garment at the moment of death, as almost a symbolic awareness of the tear that has taken place in one's heart, in one's body, in one's psyche, through the loss of someone one loved. But as a legal principle, what this was taken to mean in Jewish law is that it is impermissible for a person to injure himself even for the achievement of some spiritual purpose or even for the achievement of some psychological purpose. Not permitted to injure yourself. But beyond the impermissibility of self-injury, which incidentally is the basis on which many Jewish jurists have come to the conclusion that it is simply impermissible according to Jewish law to smoke. So I'm not sure how that would apply to these electronic cigarettes because no one knows yet how much injury they're going to do. But as a matter of reason, one ought to assume, it seems to me, that they will eventually be discovered to be producing about as much disease as tobacco. So stay away from them. In any case, aside from the impermissibility of self-injury, there's another layer of legal duty that Jewish law imposes upon the individual. And that is the duty of rescue of self. You got that? The duty of rescue of self. That is, it's not just that you're not permitted to injure yourself. That you have a legal duty formulated in the Torah in Deuteronomy in chapter 4 of Ushmartem ba'um. Guard your lives. Guard your lives carefully. Great guard. And Jewish law understood that to mean that a person has a legal responsibility according to Jewish law to promote one's own health, to guard one's own health, and to assume responsibility for self-healing in situations of pain and illness. That it's not just the physician who has a responsibility to heal me as the patient. I'm not simply the passive object of the efforts of the physician. I am an active partner in the responsibility to heal myself. And that responsibility is fundamental to our awareness, as patients. And then there's a second layer of Jewish law that I believe is applicable in these situations. And that is a teaching of the Mishnah, a teaching of the earliest code of Jewish law, based on its comments on two verses, one in Exodus and one in Leviticus, both of which speak in terms of not engaging in oppression of the immigrant, the orphan, and the widow. Right? And the rabbis understood there to be two separate restrictions related to this oppression. One had to do with economic oppression. It is impermissible to engage in economic oppression of people who are vulnerable. But there's a second layer. The second layer is the prohibition against engaging in verbal oppression of the immigrant, the orphan, the widow. What does it mean not to engage in verbal oppression? Says the Talmud, it means, for example, that if someone is ill, if someone has suffered a great loss, like the loss of a child, that it is impermissible to speak to that person in the way in which Job's friends spoke to him. remember what Job's friends said to him? They said to him, don't you know that innocent people do not suffer? If you are suffering, it must be in consequence of your own sinfulness, and therefore repent. Says the Talmud, it is impermissible to engage in that kind of verbal torture of another person, to tell them that their suffering is in consequence of their own sins. Both of those labels, the responsibility of the patient to heal themselves, and our responsibility not to use the occasion of illness as a medium of intensifying people's suffering through the way in which we speak to them. And therefore the demand that we exercise great caution in the way in which we speak to them are fundamental elements of Jewish legal governance, even in the situation in which the theological issue cannot be resolved. But we know what we need to do, what the patient needs to do, and what we, as persons existing in a relationship with a person who is ill or suffering, need to do as well. Thank you very much.
What a terrific beginning. I expected, like you have many questions, but we're going to continue on. Dr. Arzula, speak next. You may speak absolutely wherever you feel.
Well, good morning, everyone. I just wanted to start with a great thank you to the organizers of this conference. I'm very honored with their invitation. I hope you all paid your registration ahead of time so that you don't ask for a refund after this presentation. I very much appreciate the rabbi's presentation on this concept of illness, and what I'd like to do is to sort of set up what I anticipate will be repetitive questions over the three plenary questions. So I'll take the first part of my time just to lay out a little bit of a framework of how we as Muslims would approach this sort of question of illness and how would we frame it. So again, when we as Muslims are talking, it's from a vantage point of three fundamental beliefs. The first one is monotheism, a belief in God. More comfortable for me to say Allah. So from the context of Allah's will and what Allah is capable of doing and what He wills, He is more than capable of both producing illness and of producing a cure. And so from a Muslim vantage point, there is not this necessarily a conflict of trying to understand where illness comes from, in the sense that it would be understood by the Muslim that this illness is coming from the will of God. Now, understanding how to react to that and how to reach out to God, to reach out to Allah for a cure, I think that's where the interesting discussion would be for the Muslim, is trying to understand how to reach for a cure. The second component of basic belief is a belief in prophethood and looking to prophets as role models for human beings, and how we should approach both the definition of who's ill and what our response to illness is. And probably very important to the discussion of a Muslim understanding of illness would be the context of the afterlife. So a fundamental belief that this life is a limited life, and that the life following here on in the afterlife, that there is a day of judgment, that there is a heaven and a hell, that there's actually a reckoning in a place that occurs after this place. Because again, without that context, it's very difficult to understand why one may understand illness in a particular way or not. So again, those three basic beliefs, just to lay out a framework that we'll be revisiting, I think, over the next 2 days. So on the basic question of, in what sense is illness a spiritual or religious experience, I think the simple answer is yes. I'm not sure that would be a no from anyone at this conference. But I think what the questioner was getting at was, how does that manifest in the human being who receives an illness, who is dealing with an illness? How do they actually conceptualize this? So looking through these three examples, Omar, who's a 42-year-old, probably middle-aged man with low back pain, kind of sounded like me this morning. How would we understand, would we accept that as a state that Omar is sick? And I think this is a very relevant question in the medical context. There's lots of implications to whether we accept that low back pain as being sick and so on. From a Muslim perspective, we have the concept of marad, which is the Arabic word for illness. And so that illness is defined very generally. And it really is from the construct of something that is irregular. So is that in the eye of the beholder, or does it actually have to be proven by somebody else that has much more to do with, I would think, the policy context in which that discussion is taking place. So if a person feels sick, they're given the latitude to be sick. We don't really ask them to prove that, and that they would be experiencing that. I think in the context that many of us might be in, we actually have to document and figure out, is that low back pain real? And because there's several implications down the line, but from a religious standpoint, is that person sick? They feel sick? Yeah, they're sick. As far as sources of what that, I'm sorry, in the other two cases, and the young woman who's presented with stage 3 breast cancer, and Miriam, I call her Mariam, 60-year-old patient who has symptoms of depression. For these patients, again, all of those elements are very easily understood as illnesses. They would be understood as a person who's suffering from something, and I don't really think that would be much of a conflict, or much of a discussion. The question of why people get sick, I think the rabbi actually described the notion, and I think we would also have the similar notion, that one possibility is that it could be a result of one's sin. Now, the challenging part of that is, how does one understand that? Can that be identified by an outside person? Meaning that if I am observing another person who's ill, can I identify that the source of that illness was actually a particular sin? That's a lot tougher. But can I, as a person who becomes sick, ask myself the question, is there something that I'm doing in my life that might have engendered my illness? I think that's a very real question. And it's something that I think also when they receive an illness, it may be a question that they ask themselves. That question is independent of whether it is God's will that I'm sick. So the question that is God's will that I'm sick is sort of a foregone, it's a given. On the back of that, you may ask yourself, did my sin incur this or did it not? That would be certainly a question that may be on the table. Could it be an element of divine punishment? Now, this is one that's even more difficult to prove from the outside, and certainly not something that we could speak of. For us, in the context of whether that is punishment or not, also is tied to the idea that Allah himself is the master of the day of judgment. He's the one who will judge. So we don't really have that insight into whether that illness itself is a divine punishment or not. And certainly the notion that we see on the surface, that many illnesses are indiscriminate, at least from our perception. And our ability to discriminate whether that is actually an illness related to punishment or divine punishment is probably a very dangerous route to go and very challenging, and I'm not sure that we would go there. The one part of the questions I thought that were particularly interesting, sort of the supplementary questions, was how does a person in your tradition seek medical assistance? And I think this is a very challenging question. For us as medical practitioners, I think often the assumption is that we would make the assumption that that's the foregone conclusion, that you're going to seek medical treatment. And that may not always be a foregone conclusion. One of the standards that we hold in medicine as a standard is to do no harm, but often in practice what we do is, if there's some benefit, we'll give it a shot. And this is a pretty significant transformation. There's a lot of forces that may be behind that. There's a lot of ways that we might think about it. What's interesting is within our Muslim tradition, one of the working groups that I'm here with, one of our discussions over the last couple of days is, what are the limits of that? From a Muslim religious perspective, how would you determine that you've crossed the threshold that you should seek treatment? And again, the primary element that's discussed is the removal of harm, which I thought was a very interesting conversation. I think in many ways very similar to, I think, what we traditionally as physicians believe, that you do no harm, that the onus is on you to prove the benefit. You really have to have a proven benefit before you try something on a patient. And I think that, very frankly, I think is somewhat eroded. And oftentimes in our real practice, we're not necessarily holding to that principle. But I think that's a challenge to this concept of how we would address illness as a spiritual experience or a religious experience. So that when a patient comes to us and challenges us, doctor, you're saying that I might have some hope if I do this. How much trust or how much faith should they have in us to actually do that, I think is a very challenging question, regardless of our faith tradition. So again, sort of in summary, all of these three patients that we were presented, I think we would acknowledge them as ill. I think the approach to how they might seek help and so on, I think will come out in the other two sessions. But I think the challenging question that I would be interested in order to take is, what threshold does someone have to cross when they seek that help, the physical medical help? And is that actually attention that exists for other traditions?
training, he finished early for his allotted time, so I think his already used will be very high. The clinic manager will be very pleased with you. That's all right. Without further ado, I'd like to welcome Dr. Moore, our last speaker before the payment session.
Thanks very much. I'm delighted to be here. And I'm just going to say a few things make a few points about Christianity and then talk about my approach to the question posed. Because since this is my first time before you and I'm the designated Christian, we've been talking about this being a bad bar joke. A Christian, a Jew, and a Muslim. Anyway. Okay. Then I need to make sort of a full declaration. I am a Christian layperson. I'm specifically Episcopalian, have been most of my adult life, but nevertheless I'm indelibly genetically Lutheran. So you can hear what I'm saying in those lines. But the necessary point that I really need to begin with is the impossibility of speaking with any absolute specificity for a tradition as variegated as Christianity, which means I'm not going to be telling you what Christianity thinks about the cause of illness or the sick role or when something counts as an illness or when you should seek treatment, because you can find any answer and any objection within Christianity. For many years I have taught an undergraduate course in the ancient and medieval history of Christian ethics, and the hardest things my students, who are mostly professed Christians, the hardest thing they have to grasp is that there is no one clear and unqualified strand of teaching, much less systematic theology, that one can trace through the historical and global breadth of the Christian traditions, other than to say, basically, twinkle, twinkle, little star, or something like Jesus matters. And that's notwithstanding the tradition, the tendency of any given Christian, including me, to think that our own version of Christianity is the one that's definitive and true and always has been. That said, there are at least two things that we can bear in mind that Christians may well agree on if you don't push the details too hard. Both of them having to do with Jesus, and one of them is the relation of Jesus, who is in some way also the Christ. That's one of the places where the details matter. The relation of Jesus to God reveals something very important to us about God's relation to humanness and thus to us that matters for our understanding of what it is to be human, to be both physically embodied and in spiritual relation to God. And the other point is that Jesus' resurrection, here again there's some details to talk about, but that Jesus' resurrection reveals something equally important about the necessity of death for human beings and the possibility of life after that. So that for most Christians, some understanding of incarnation and resurrection significantly shape our ideas about humanness and embodiment and finitude, all of which, of course, are highly relevant to how one interprets and holds experiences of illness and injury and death, as well as shaping understandings of the nature of God, what we can count on in our relationship with God, and about our relationships to each other and our responsibilities to and for each other. But having said that, it is also immediately necessary to note, especially I think for our purposes in this conference, that there's very often a persistent and meaningful distinction between the theology of any given tradition, Christian tradition or congregation, and the beliefs and practices of that tradition's individual adherents. For one relatively common example, think about, those of you who've been in this situation, the sometimes rather urgent requests from parents to have their seriously ill infant baptized, even though those parents may be firmly grounded and engaged in a version of Christianity that does not believe that baptism is either required or effective for an infant's eternal well-being. We surely see that their desire for the rite is likely to be something very important for them, something more than just honoring a social convention. It says something really important about establishing their baby's existence, their baby's place in their family and their religious community. That is, we can and should understand it as a deeply spiritual need that calls for an appropriate response, but it doesn't track with the tradition's theology. And this combination of variety within Christianity and discrepancies between official teachings and lay belief means there's just no amount of learning about Christianity that can substitute for asking each individual patient about their own spiritual understandings, about what beliefs impinge on their experience, what practices matter for their well-being, and then listening carefully to the answers. I think yesterday's really terrific panel about Ms. Watson's situation rather brilliantly explicated that point for us. So that our goal shouldn't be cultural competency, that really dangerous trap of a concept, but cultural humility, right? Reminding us of the need to be open, to ask, to listen, and to learn what constitutes the spirituality or religiousness of that other person before us. To that end, I want to briefly offer you my own working understanding of spirituality broadly conceived, which I think you'll hear has a lot of resonances with what Rabbi Berman said. Some differences, but some resonances. Because it is how we grasp that concept that determines our understanding of how it is and must be deeply engaged in illness. In my view, our spirituality encompasses at least two major closely related activities, which are very much the two that Rabbi Berman has been talking about. First, it holds our theories about the way things are. Okay? Our beliefs about how the world works, where we fit into it, whether there's anything else out there, and what our relation to that anything else, that someone or something transcendent or divine might be, and the practices we engage in to acknowledge and honor those beliefs. I think where Rabbi Berman and I may part company is in the assumption that spirituality always includes a notion of God. I am more of the mind that everyone has some sort of spirituality, some sense of the way things hold together, some sense of coherence and making meaning. Religio, the Latin root verb of the word religion, means tying, binding together. So our spirituality is our religiousness, our making sense of things, our making meaning, it's our coherence. It's largely because we now use the word religion to mean particular religious traditions, very specific instantiations of spirituality or religiousness, that we draw distinctions between spirituality and religion that sometimes do and sometimes do not serve us well in our discussions like this. So spirituality is about coherence. It is also the locus of expression of our value. It is what the 4th century Christian thinker Augustine called our ordo amoris, the ordering of our loves, that regardless of whether one accepts any notion of God, much less whether one is at least a bit Augustinian, we do order. We rank our loves, the things that matter to us, which is to say that we value things and we value them differently. And that act of valuing, of setting priorities, is a spiritual activity. It directly reflects our basic spiritual beliefs about how things are and should be with the world and with us. Whether we're deciding how to distribute our time and money, or deciding how to vote, or more directly relevant to this discussion, deciding how to manage risk, or how to take care of our health, how to choose between more chemotherapy and one more month to live, or deciding how to attend to our patients. Coherence and ordering. And the power of pain, suffering, loss, to disrupt the coherence, to shatter our settled understandings, to turn sense into nonsense. And its power to challenge the ordering, maybe to eliminate and clarify it, to throw it into relief, maybe to throw it over, requiring reordering. That power makes it inevitable, inescapable that spirituality and religiousness are deeply engaged in all experiences of serious illness or loss. And that's the sense. It's undeniable, I think, scariest in the face. And as I've said, I think you all agree with this, you wouldn't be here, right? In which illness, injury, dying in ourselves or someone we love is unequivocally always a spiritual religious experience. Serious illness disrupts, even destroys the sense that we have always made and lived by, our sense of the universe, of God, and of our lives, and exacerbates the suffering of the illness with the additional suffering of spiritual turmoil. This is important, and I'm glad we can talk about it, and I'm going to leave it for everyone else.